So let me see what is this one. This one, we just this one. Can we see this one? No, okay. Log in. But at the same time, what I have to do, go to the email. Whatever in window installer. Mail. Okay, so go to what is 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 it? Oh, this one. So we have to go to midterm, almost midterm. It means 2 hours, 2 hours exam. Wow, good. Hours. Questions. Okay. So that's not batch. Coming Tuesday. What is the date coming Tuesday? Mm. So it's 23rd. Yeah. Yes. Remaining. 26th, 27th, and the okay. 28th Russia. Wait. Amish Friday off. Saturday, Sunday working. Wow. 23rd. 23rd. 24 from uh, Subhira. Okay, Subhira has been sent. The team. You have to manage quizzes, then you have to the content. Content also you can open another that page what is called inbox. Vitals. Vitals. Okay. So here in the vitals. Overview, PowerPoint. Okay. So campus login. 64. No, 60. People who is missing. Amina, Astrid, Christiana, Chris, Pasado, Evelyn, Huda, Joanna, Cara, Luis, Maris, Rubia to Santiago. So till Sabana and Alexia are missing? Looks like. I don't see Sabana. I don't see Alexia. Is there any message from them?
Alexia mom has a message. She said she'll be late. 9:15.
9:15 is going to come tomorrow night.
Yeah. On WhatsApp.
Yeah, okay. No message from Savannah so far, right?
Yes, mom. No message from Savannah.
Good morning, Miss Munmun.
Yeah.
Yeah, it's Yusra.
Yeah.
Yeah, so I have school meeting today at 12 o'clock for my son's school.
Okay.
So I'm gonna leave by 11:30. Maybe I'm gonna be away for around 45 minutes.
Okay.
So I'll be on team, but I'm not gonna be maybe on this time from 11:30, maybe up till 12:15 to respond.
Okay, that's
But
fine. We are going to complete the vitals and then basically you guys doing the review by your own or in group as you like for your ECG final. For you, ECG is okay. I think you already read it, so it's okay. You can do by yourself.
okay.
Thanks for letting me know so that I am aware of that. That's why I can handle the situation. Okay? Thank
Okay,
you.
thank you.
Okay.
Thank you very
Okay,
much.
no problem. Okay. So let me open up another thing. Oh dear. Now I have to a team. In the files. Is that in this? Okay. Yeah. So what's the one? I don't know. If in 920, I'll give a little bit time and then enter to get attendance. Is it ECG unheard? Today is 17th, right? Okay. Good. Presenting. Okay. Save now. Good. This one is saved. Have to go to the next one. What is calendar here? Okay. And I have home page of this one. So you can go to the attendance. What is that? WhatsApp who is sending message now. Because she was she was on team on and she was not present. That is a maximum bad offense that you cannot leave the team on and you are absent. Yeah, that's totally extremely bad reputation. It can go against your, they can take out from your class course. You cannot send, yeah, you can go for 5 minutes or 10 minutes or something, begin or up. So if you know me and whole day, not a single time she showed up her face, do you think is acceptable for the college? No. You cannot hear, you cannot problem in the microphone or this and that. That's a different issue. But that is very unacceptable that you are on team. That's just going to happen. If you are not every day on team or you doesn't update with your friends, okay, I was not here, or she can text me or in the WhatsApp group, what's the update? Like others people does. How is your class today? Is there anything new? So she have to update among your itself. It is your problem. It's not my problem that I am going to inform individually. I inform individually in the class. If there is an individual things, I send email individually. I know I accommodate everyone for everything, including me. I have some problem also, right? But if I know, I try to adjust with everyone. Okay, you want to go early because everybody needs something. But you are not going to update me anything. You are going to the team. It's not like that you are super clever. Because here everything is monitored, and I'm telling you, for couple of people at the beginning, for the attendance problem, for this type of thing, our class for the attendance, not for the study, you guys are doing good. For that one, for the study, you are on people spotted pin, they already pinned you, so they monitor everything, who is coming, what time is coming. That's why I have to write it down, who came 15 minutes late, and I have to write the reason. Okay, Luis has the car problem, or this one's son is sick, or has to go to the doctor, or go to the son's school, so that they understand also. We are on ECG. Okay. Anyway, let her do what she wants to do. I tried to save her for so many things in the from the here. Already have problem. Except her, everybody is present who was not here. Shabana is already here now? Shabana is not here till now. Yeah. Alicia's not video. Again, same thing. What
Ma'am,
happened to, yes, ma'am?
I just wanted to let you know that Regatu's audio is not working properly.
Yours.
No, not mine. Regatu Grace.
Okay. So her audio is always problem. I know. That's why I always shout on her, like the shout, not shouting. I raise my voice to call her, every time. And she raised her hand. So at the beginning, it was a problem. I know where's the problem. Maybe it doesn't have that sophisticated one. It happens to everyone. Like
Yeah.
Sabana, yesterday computers become dead and going to funeral, and she didn't show up today till now.
Yeah.
Sabana's computer battery was dead, went to the funeral, and the Sabana didn't show up today.
Yeah. She just wanted me to let you know that she'll be going to her doctor's appointment.
Who?
Grace.
Okay, what time?
So she said her video will be off for like just a few minutes, but she'll be coming back.
Yeah, she's not here now?
She's here right now, but her audio doesn't work.
Okay. No, her audio is always problem. Thank you.
Yeah. Okay.
I know her audio is okay. Yeah. Rugiato, I can see you. We are talking about you. Yeah. You have to go to doctor again?
Yeah, she said she has to go for her immunization for the hepatitis B.
I know.
Yeah.
Rugiato, I know your computer is always problem, okay? So whenever you like to say anything, chat me in the text me, because sometimes when I'm teaching, I'm in the other screen. I cannot see everyone, so I can go back and forth, okay? So if you send me a chat, or then we can understand, or anyone can group in the, or you can talk, or anyone from the group can tell me that, okay, Rugiato has questions or something. So you are going for your vaccination today now? What time? Now? Okay. Go and come back and join me, okay? And stay on team, okay? Okay. Good girl. Thank you. Thank you, Christiana.
No problem.
Okay, so I don't know what to Savannah now. Savannah, no info. Give me 1 second for is Bheda answer anything? Bheda confirm. So Bheda already confirmed me. So your midterm, not this week. I'm not talking about this week. Don't confuse. As we discussed, your midterm theory exam is going to be on campus next week, next Tuesday, right? So it's confirmed. Okay.
Yes,
Thank
ma'am.
you.
Thank
Okay.
you.
Okay. I
Thank
got the
you.
email from Veda, so it's booked. Okay. Thank you.
Thank
Yeah.
you.
Thank you, ma'am.
You're welcome. Replied to Vera. Good. Okay. Attendance. I don't know. The is present. Christiana is present. Yusra is present. Okay. Yusra present. Amina present. Asnet present. Inghang present. Oh, what is this one? Who stay? You. Password ethnicity saving. I have to put D7. Okay, so I'm D7 percent present. Kishana use represent. Okay. Amina present. Asnet present. Ingham present. Alexia led. Zenaida present. Fazard present. Santiago present. Joanna present. Chris present. Cara present. Savannah absent. Okay, Luis present. Evelyn present. Luis present. Okay, Rigiato present. Mary's present. English present. Okay. It's not bad. 20 per page. I can save it right now. So vital signs. Okay, let us go to the topic so that we can just discuss and then you can get as much as possible time for your review. Okay. Okay, as you like.
Okay, ma'am. Thanks.
Okay, no problem, dear. It's already, I just waited enough for this. Okay, so there are a couple of quizzes. Okay, so you can do it if you want today after the PowerPoint is done. It will not take that much time. But if you tilting, but you have to do the quizzes so that you can get the professionalism mark once we are learning this one. Or you can do it tomorrow also after your tomorrow is test, right? Is that right?
Yes, ma'am.
Yeah,
Tomorrow
yeah.
I'm
So after
ready.
tomorrow, you can do the quickly test and then we can start little bit midterm review, what is on our D12 platform. And then again, I have to work on yours midterm. There's a lot
Thank
of
you.
work. Yeah, okay.
Yeah.
So let me start this one, vital signs, PDF. So what is the vital overview? Let me before showing this. This is not the oh, I have to share the screen. Mhm. Mhm. Screen. Okay. So good. So close this one for now. Okay, so I have to share this one. Okay. Vital signs. I am on the, you can see my screen. So I'm going to this one. At the same time, if you hear anything from Saban or anything, okay, within 10 minutes, let me know because I have to close the chapter of the attendance. I already updated for everyone. So you can hear me and you can see my screen also.
Yes,
Yes,
ma'am.
Yes.
Okay. Okay. So we just yesterday talked what are the vital signs, the signs which makes tell you that you are still alive. That is the vital signs. Okay. You are still alive. So you are taking breath. If you're taking breath, oxygen is going, your heart is functioning, that means it's giving blood and oxygen, nutrients, everything all over the body. You are generating blood pressure, which you can feel from the outside to make sure you are alive. Your respiration rate, we can see how you are respiring, right? And your blood pressure. So there are 3 things for your vitals. So these are, you have already your PowerPoint. So you know your reading references. I don't know how many you guys go in the reading references and do that one, because there are a lot of information for the textbooks and other things. But basically, if you are alive, you are going to have a blood pressure, which you can monitor. You can feel the heart rate, which is also from the pulse. You can get that one. Your respiration rate, how many times you are respiring, and obviously by body temperature. The things we can see and feel from the outside is called the vital signs. If you are pale, if you are cold, if your respiration is very low or is high, so we can, and if you doesn't respire till we can see, that means we can feel whether you are alive or dead. So this is the from which the signs which can understand a person is alive or not, that is called the vital signs. And what is the terminology VSA? Anyone knows? If you doesn't know, okay, just let me know whether you know or not.
No, we don't.
Okay.
We don't, ma'am.
Okay. Okay. VSA is vital signs absent.
Oh, okay.
So
Thank
in
you.
hospital, in emergency, there are so many patients sometimes come, it's called the VSA. That means in theoretically, patient is dead. Okay. So that time, if there is a heart block or anything or something is within 10 minutes or 15 minutes time frame, or is coming from the EMS, they said when the EMS went to the home to pick up the patient has no VSA. They are trying to do their best during the transport and also coming to the hospital. Then what is the rules? They can intubate CPR or whatever to sometimes bring the patient back if it is in the time frame and it's not the major. So it is the thing VSA terminology is just wrong, vital signs absent. Nobody is going to chart in, whenever you come, the patient is dead. You cannot write that. Medically, we cannot like that. We say, oh, the patient is no more or patient is dead. But when you are using the medical terminology, you have to write absent or VSA. So from there, immediately you can understand, oh, the patient is not alive anymore. Okay, good and unquote.
Miss Moon Moon,
Yes, ma'am.
are you saying PSA?
V, vital signs. V as in
Oh,
vector, vital signs.
Oh,
Yeah, we are talking about the vital signs, right? When the vital signs are absent, it's called the V
yes, they're dead.
for vital, S for sign, A for absent. Vital signs
Oh.
absent. Okay?
Thank you.
Okay, okay, no
Ma'am,
problem. Yes.
is it the same as DOA, dead on arrival?
No.
What is called? DOA.
DOA,
Yes.
is it the same?
Similar,
Similar.
but
But when
don't
they
bring them to
reach
What is the DOA? What do you mean by D?
Dead
dead on
on
arrival.
dead
arrival.
on arrival. Right.
Nowadays that terminology not used. You cannot, because you doesn't know whether you can survive the patient or not.
Uh-huh.
I
Dead
think
means
when the paramedics arrive to the scene and the person is clearly gone, deceased, then they can say
Yeah.
DOA.
yes.
Yeah.
And then
When it's
they will
totally,
take them to the
totally. But
hospital.
when the patient is
Yeah.
coming, you doesn't know whether can make the alive again
No.
or not. So you cannot
Yeah.
tell that the patient is dead.
That's right.
Very delicate using the medical terminology.
Yeah, that's
So
true.
that's why you saw VSA.
Okay.
And then
Thank you.
then also when the patient cannot do anything, then we read the deceased or cyst. Okay, so that is the terminology with date on arrival. That terminology is not used at all, because you never know whether patient is really cannot do
Still,
anything.
yeah, that's
Yeah,
right.
yeah, yeah. Okay, so sometimes
Miss,
yes.
I think they still use it in a sense where Cara and Evelyn is correct in a sense, because they have to chart it, and that's what's in the chart, and they have to code it. So that's how they code it. Dead and arrival.
Code.
Yeah, yeah, they
If there
code
is
it.
no
So
if
and
there is no
they
VSA,
chart it and code
there
it.
is no VSA, code blue. You that
No,
mean that
not that kind of code. No, the code that I'm talking about is a charting code. So they chart it saying that the patient dead on arrival, and they code it for the hospital to get paid as dead on arrival. So they're right in that sense.
anyway, I have no idea, dear. Whenever I am in the hospital, whatever I say, we say the VSA. Maybe I have no knowledge about that. In hospital, nowadays, we don't see any DOA because we deal with the TRAJ or EMS chart, right? EMS also don't write anything like that. They write the VSA.
Mm-hmm.
And only doctor, after examining, if the thing the patient is really dead, nothing can be done, they write a deceased or something like that, or sometimes DNR. So even the patient arrives at the VSA and there is a note that DNA, sorry, why DNA,
DNR.
DNR.
Yes,
What is
ma'am.
the DNR means?
Do not resuscitate.
Okay, so if you came the VSA, there are a couple of streams. One of them is resuscitation, but if they said the no, you cannot do that, so that means doctor will write the note, see the note of the patients and the symptoms, and then doctor is going to declare whether the patient is. We never use the terminology date here. I don't know. It may be that the date on arrival is maybe used, but in hospital till now, so far, I didn't. Maybe it's used. I have no knowledge. Maybe I will check that one, because that's why I asked them if the patient is no vital signs. Why you are doing that? I don't know about the charting in the system for health insurance or government and other things. But what are the medical way it comes to us as things, we saw this one. Maybe there are some codes, what you told during the charting in their record. But when they're
Yeah.
giving the symptoms, maybe I don't know about that part. Maybe for the payment or this and that. Maybe there is another one. But yeah, but as per the treatment and diagnosis, and so we use this because until the patient is totally, doctors recommended that the patient is no more. See, I cannot say dead anymore also, because we are so used to use this terminology. Patient is no more. So then it is written in the chart, the patient is deceased or something like that. But yeah, maybe for the because I don't deal with that billings and this and that. So I am not at all knowledgeable from that part. Maybe there are some codes. I'll ask the ambulance people. That's a good idea. When they will come, I'll say that, did you chart anything dead on arrival? Or the doctors. That's good to know. I didn't know that. Yeah, data analysis. I never heard about that also. In the medical terminology,
We're all learning.
yeah, we did the whole total medical terminology, right?
Yeah.
Did you have this one? We didn't see. I never see the DOA in the medical terminology.
Yes, ma'am. We used to have that terminology back home and
Back
also in
home.
the
Yeah,
Middle East.
yeah. Back home we have. Even
Yeah.
even
I've
in
seen
my
it in the
I've
funeral
seen it.
industry.
I've seen it a lot of times.
Yeah.
I've seen it. I've seen
yeah
it in the emergency charts most of the time in emergency charts.
Yeah.
Yes.
here.
Not
Most of
here.
the
No,
time.
Yes.
for me, not in Canada.
Here,
But
most of the
That's
time.
I'm
outside,
talking about the
yes.
Canada. Yeah, in my country. In my country, they do the DOA.
Yes, ma'am.
They have no
Yeah.
terminology of VSA. No, 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 no.
Yeah.
I am talking about here. Here, I never saw
Here,
this one.
yeah.
Back home, yeah, back home, DOA. is basically the patient is dead. We use the dead. Here we doesn't use the terminology dead. Patient is no more, or
Mhm.
patient have
Um,
VSA.
It's here.
My
It's here in the chart. Go ahead, Cara.
no, it is. My husband passed away a year and a half ago at home,
Oh, sorry to
and
hear
on
that. I
Oh,
his
didn't know that.
sorry,
Yeah.
sorry,
Sorry,
Kara.
sorry.
on
We never know. Oh, sorry. Very sorry.
Yeah.
Sorry,
That's okay.
Kara.
Sorry.
But
Oh.
on his coroner's report, it was
Mhm.
like DOA. And when the paramedics come to the house, they knew right away there was nothing to do, so they tell the coroner, and then the coroner comes and confirms
Okay, that is
it's
the different
DOA.
issue. Okay, so
Yeah.
because he was not into the hospital.
Absolutely. If he had been at the hospital, it would have been what you were
VSA.
saying. The
VSA.
vital signs
VSA. Yeah,
absent,
yeah. Here,
deceased.
the
Yeah.
ambulance, the paramedics people has the authority to declare, or any some nurse, if they come, if somebody passed away at home, they can come check all the vitals. Okay, because they already check the vitals and they see the patient, or and then if they say the patient is no more, then they can write that one probably DOA, and they are
Yes.
putting the patient directly from there to the your
Funeral
another
home
place for yeah. So
or the coroner. Yeah.
yeah, and also that's why. But when it's dealing with the hospital, here is the you cannot say the patient is totally dead. Yeah, in home you are right. I saw one of my brother-in-law. He passed away at home, and yeah, the here that time the EMS didn't came because he was sick in the hospital back and forth. So they sent one nurse practitioner we call, who is the just below
Yes.
the doctors. So they sent the nurse practitioner, and she already did all the things, and this she declared that whenever she came. On her date of arrival, patient is dead.
Yes.
And then they had been transported from there to the corner house. Yes, yeah. But I never saw when they are coming to the hospital, because till now they said they cannot declare until the doctors or the emergency team, declare that the patient is no more. So there also they doesn't use the terminology. The date is called deceased. See, there are so many rules. Oh my God. You are right. I saw when my brother-in-law passed away, they came in the home and they did that one. Anyway, forget it. I just like to tell you the terminology, what is VSA means, absence of
Thank you,
vital
Miss.
cells. But that time with the discussion, we know a lot of things. Yeah.
Yep.
S-
We
Yeah,
learn.
yeah. And those are the very practical things of our life, right? Nobody knows who is going to face what at what time in our life.
It's true.
So hard, so
Right.
hard. Yeah, yeah. Just anyway. Kada, if you don't mind, I'm very sorry to hear that. But just as a medical professional, what happened to your husband?
A heart attack.
Hush. First time? One time?
Yeah. Just it was like just out of nowhere. He had died late in the night, but we didn't know.
Hmm.
Um,
Oh,
and then I got up
really?
to I got up to get ready for work, and I found him, but
Oh,
he was already very, very, very gone. So there was nothing they could do.
already cold. Starting getting cold.
Yes.
Yeah.
Rigor. Yeah.
Oh my God, so pathetic. Oh my God. Even you feel that, even he doesn't make anything that I am feeling chest pain or this or that in sleep.
It was the coroner said it was very, very, very fast.
Yeah, that's why I'm telling massive blocked or something like that. And even he didn't feel any chest pain, any discomfort or anything. Instantly
Nothing.
shut down.
Yes.
Oh my God, he's to be wrong. Very sorry, but this were,
Thank you.
oh my God. Oh my God.
Mm.
Yeah. Uh,
Sorry.
but I
Very
really,
sorry.
really salute you, Khara. But till you are so strong, you are doing your
Yes.
career. My
Very
God, God
strong.
bless you and your family.
Yep.
Yes, very
Yep.
strong, Kara.
Thank
Very
you.
Very, very
strong.
strong, and yeah,
Very
God bless
strong.
you. God bless you.
Yeah.
Thank you.
Yeah.
He is not physically present, but he's going to be with you always.
Yeah.
Oh, he is.
Yeah.
Yes.
Okay.
Yeah.
Thank you.
Yeah.
Yeah. Okay. So
Sorry for that, Tara. It's
Yeah,
really
sorry.
sad. Yeah.
Yeah.
But there have been so many heart attacks cases for the past
Right.
3 years.
Yes.
Yes. I think
A lot.
they have to do some study or research about that because
Something.
yeah.
And very young too, right?
Yeah,
Very
exactly.
young
Didi
people.
has a COVID.
He had the COVID vaccines, but he never got COVID.
COVID, okay. Sometimes COVID makes your heart. COVID has so many side effects,
True.
and the vaccines
It's
too.
so true.
Yeah.
Vaccines too.
The vaccine,
Vaccines
yeah.
too. Both.
Vaccine, yeah.
I am
Yeah.
not telling only that this one.
Yes.
COVID has the side effect. At the same time, vaccines has the side effect.
Vaccine, right.
Yes.
Yeah.
Yeah, that's true, Mom.
Mm-hmm. My God, with the
You know-
vaccines,
you
we
know-
saw so much blood clot. You remember? We have to
Yes.
I
come to the
know.
patient. Every whole body is that type of sudden blood clot. If there is a huge blood clot from
Yes, Mom.
inside
The
the body,
J&J,
we
they
didn't
say.
break out, and suddenly it goes one of the coronary artery or any of somewhere. Fine,
Yeah.
blocked, done, no circulation, immediate.
That's
Mhm.
true.
Miss, I
But
know.
even when I was embalming bodies after the COVID shot had been out for a couple of
Mhm.
years,
Mhm.
when I would embalm them and I would drain them, the stuff that was coming out of them I've never seen before in my life. It was like white, thick clots. And it was,
Oh my
I don't know what they
goodness.
were, but we couldn't break them down. And these were
From
people who
where?
were just
From where?
dying
From where?
from their circulatory system. So when they would start draining, you
Yeah.
would see like regular blood clots and blood, but then all of a
Yeah.
sudden these big, long, white, fibrous, rope almost like material would start coming
From
out.
the circulatory system.
Yes.
No.
So you are from
Oh.
where you are doing this one? From the heart, right? You just do the
From
for
from
the
the whole
fixation, for the
circulatory
fixation,
system.
right? Yeah, you have to drain out the whole
Yes.
blood and put the, it's called the fixation of the body. Yeah,
Ah.
we do the for
Yes.
the animal. Yes, so you have going to
Oh
put
my goodness.
one needle to take out and one needle to put the fixating.
Yeah, we open the carotid to fill the body and we open up the jugular to drain it. So
Yeah.
during the draining, it was just unreal what was coming out.
Oh yes, Kara, when you were funeral director, right?
Yeah.
Yes.
You
Yeah.
are
Okay.
one of the strongest person I ever knew.
Oh my God! So nobody did any research or anything on that. That what is that?
They
Why is the white one?
Well, the funeral directors in the United States and in the UK and in Canada, they've been trying to bring it to the light. Like, this is not okay. This is not right.
Yeah.
But they're being shut down. They're being ignored because the government doesn't want people not to have these vaccinations for some reason.
Political issue.
So, yes. But I took pictures of the blood clots that I pulled out, the big white ones, because it was unreal. And I was trying to explain to my family, like, this is not okay.
Wow.
And
So
then
this
there's
was
also
within
YouTube.
COVID. This was when COVID was happening, Cara.
Yeah,
Yes.
who
So,
is
like,
who is
when the
sacrificed their life for
vaccinations,
the COVID? Yeah.
yes.
Okay, these people
So when the
took the
vaccinations
vaccination.
came,
Okay, Kara, I have one question. These patients, is the patient? Sorry, I'm digging you too much. So this patient, from where
Yep.
you are getting the blood, who is passed away from the the COVID, whether they are all after the vaccinated people or non-vaccinated people, or both have the same thing.
vaccinated. Only the vaccinated.
My God.
And these were young people who were just in their kitchen with their families, and all of a sudden they dropped dead. And they were young, they were healthy, and there was no cardiac history, there was no clotting history. And they would come in and we would prepare them, and these white things would come out.
No blood, nothing.
Oh, the blood would come out like the normal blood, but then all of a sudden it would start these white things. We would see them on the table, and they were in the shape of like your like an artery or wherever they were lying, because they would get dislodged from the pressure of the fluid going in. And we would, and sometimes they would even start clogging the drains.
Oh my God.
Yeah, it's bad.
Oh my God.
Wow,
See? Do you have the pictures?
Yeah. I do.
Sometimes could you please show me?
Yep.
Okay.
When we come to class next week,
Yeah.
I will show you the pictures.
Okay.
So all of this is from like COVID, right?
Vaccination.
Vaccinated
Yeah.
Well, the
vaccinated
vaccine.
COVID.
Yeah.
Vaccinated COVID. See, nobody works, nobody, because if they doesn't give attention, how the researchers are going to do that? Even the researchers are handicapped that time, Even
Yeah.
the vaccine they
Yes.
made, that vaccine for going to a vaccine any market I worked in the clinical research, it takes 3 years to make sure whether there is
That
no
it's safe.
side effect or anything. If there is side effect, what type of side effect and how you can deal with that. Here they
That's
are
right.
the vaccine, what the meat the vaccine, I have to take it because I am working the healthcare professional. I
Me
have no
too.
choice, otherwise I cannot have the job. Some of the doctors, some
Yeah.
of my colleagues, they refuse to take the vaccine and they are out of the job.
Yes,
They
Yes,
are
that's
that's
out
That's
of
right.
the
right.
job. So
Yeah,
this is so
120 from
frustrating,
our
so
place.
frustrating. Even taking the vaccine, I have the COVID. Who is not taking the vaccine, they have the COVID. So COVID was COVID. It doesn't
Yep.
mean that the vaccination is nothing. It said how many people in the population is going to get the COVID. The majority of the population is going to be immunized by itself, by your
that's
self
right.
immunity.
That's right.
Yes.
Self
Yes,
immunity vaccine makes
That's
the
right,
words
ma'am.
worse.
Yeah.
The when the you can see when a majority some people didn't able to take that things because that time they were not careful. There is for the COVID, there are some couple of preventive guidelines. So if you can take this, but sometimes some epidemic things happens. But the
Uh-huh.
vaccine didn't do anything. Didn't do anything. That is the for
It didn't.
government policy, getting money and
yes, it's
that's yeah,
business.
the company
Yeah,
Yes.
company
Into it,
business,
yeah.
yes,
company business. You can see specifically one. There are so many people do the research. Specifically, one or two companies they bring it in the front. Wherever they are getting the money, the politics. That's the thing. I should say that.
That's true. Yes.
Become. I was so for a long time. I didn't take the vaccine. Even they are
Yeah.
telling these,
Ew.
but at the end they said you are going to lose your job if you
Yeah.
didn't take the vaccine.
Yeah.
So
That's
I
right.
have, yeah, I have no, and I feel in the I in this hospital, so many people at SOB, so many people. You tell the heart problem, weakness of heart.
Yeah.
Somebody has liver, somebody has
Mhm.
problem in the what is called. This vaccine make a different types of what the vaccine is. I have no idea, dear, but there are lungs problems.
A lot of
There
clotting too
clot in the
happening.
lungs, in the clot, heart problem. Then obviously there is so many. You can see whole body. You can see the I can like the clotting. That means platelet is not functioning properly. Sometimes
That's right.
platelet count is too low.
Mhm.
So, in addition to taking care of the COVID patients that time, we have an extra pressure for taking up the patient who is vaccinated. And what is happening? These people taking the vaccination, coming to the hospital where we have lots of COVID patients and we have
Yeah.
no space. So we
Mhm.
cannot put everyone in isolation. So who is not even COVID coming with the vaccine problem, they are getting COVID now.
True.
Yes.
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 Nara, I
So,
have a
sorry, Miss.
question.
Sorry, Miss. I'm so trying to listen you guys what you said and to trying to understand. I'm very so sad to hear about Kara.
Yeah.
Just a simple question, yeah, Miss. So what you said, you mean that taking vaccine also bring the risk to the human, right?
Yes.
Is that the opinion, right? I'm just trying to understand you guys. Sorry.
It's okay.
Uh,
Jin Hong.
is that in? Sorry, Miss.
Yes, Ying Hong. I think Miss was trying to say that there's a
yes.
lot of
This is what
side effects.
this is what studies showing like lately.
Yeah.
So
Okay.
basically,
Yeah.
for any medicine, any vaccine,
And
anything is not like no one is side effects free.
Yeah.
But you have to see the
So
balance, what type of side effects it has, whether really, the scary for your health or is good for your health. So if you see 10% side effect and 9% good, they will clinically approve the medication or vaccine or anything for the market. But you have see 50% side effect. Oh, if I take the medicine, 50% kidney is going to be damaged, but 50% you are going to save this one. There is a balance. Those type of clinical trials is going to go with the volunteer consent who is at the end stage of a life, or so they doesn't care anymore. Okay, I can be a volunteer for this type of research. So you cannot do the clinical research for anyone. So first you have to go face animal research, then you have to go to the first rat, then monkey, then you have to go to the people who can volunteer as a research participants, and then from those data, see, it takes so long time. Then
Yes,
those
it might
is going
take
to
10 years.
3 years minimum,
Yes.
3 years,
Yeah.
minimum 3
It
years.
could take
So
up to 10 years
yeah,
sometimes.
so and till you can see some drugs are withdrawn from the market.
Yes.
Till sometimes
true.
you can see, because because even that time they said that one, but till now this is going to, now maybe there is more better drug for that, and that one has compared to that one has more side effects,
Side
which
effects, that's
which
right.
which probably was not become able to show it in the study. Sometimes it happened like, okay, these drugs has this composition, this structure, this may target this. So they mainly focus on that. They cannot see the every part, every organs of the body, depending on the nature of the structure of the drugs. They feel what is the action, what is going to happen. But there is something news come. So this is the thing, and I don't believe, we don't believe actually that vaccine, but we have to unfortunately take it. To be honest with you, my husband, after taking the vaccines, he becomes so weak. Till now,
Yeah.
he's performing
Yes.
everything, but I never saw he was a so strong man. He never used to sit. Now I can see when he's going up, down, he feels so weak. He's holding the rail. He's feeling the. I don't say anything because I don't like to break the strain. But I
Yes.
can see
Yes.
how he's feeling. He's feeling. I feel that he's taking the deep breaths. But all other blood tests, then everything is normal. So this is the side effects.
Yes.
Yes,
And this
ma'am.
happened
That's
when
right.
he take from the fourth one. They compelled him, the sick kids,
Yeah.
to take the fourth one. Up to third, he became able to resist. But the fourth one, he got sick after taking the vaccine.
Same thing.
After
Same thing,
taking the
ma'am.
vaccines, he got the sick, and now the whole health is breakdown. And he's
Yeah,
always
we
telling,
had
"I have
only
no
3.
energy. I have no."
Also.
Yeah.
True.
And anyway, let
I
us
have
go
a question
10.
for Kara. Kara?
Me too.
Yes.
Yeah, me too.
So in Grosno with the COVID, do you still have those whitish thing up to this day? Do you still encounter
The
those?
pictures?
No, I mean
I have the
for
pictures.
dead bodies. When you do you still have those
The
today?
pictures of the ones I pulled out?
Yeah,
I still
no,
have a picture.
I mean the dead bodies that you do for injection of formalin. Do you still encounter those white thingy? The
Well, I've been out
fibrous
of the
Oh,
for
okay.
yeah, I stepped back for a bit.
Okay. I
But I'm
understand.
hoping to become like a contract embalmer, so just doing like prepping the bodies. But right
Yes.
now, I don't do it right at this moment.
Yeah, okay.
It's
Thank you.
okay. If you are got easy, is this job, you could get this job, so you can choose whatever is good for you.
That's
Yeah.
right.
Yeah,
Yes.
sometimes you need the mental setup. Sometimes you can do it one job at
Yeah.
one time. Maybe that job may not be, suitable or give you
Yeah.
something feeling. So it's totally up to you, Kara. But you are a strong lady. I
Because
really
she's
Yeah.
so strong. Oh my gosh.
Yes.
appreciate and
Cara,
salute you.
Cara, I have a question
Yeah.
for you for that
Yep.
white thing because I'm I'm kind of wondering to myself with that white thing, that ropey stuff that you see. Do
Yep.
you ever, when you guys do that, do you ever get to see the coroner's report to see what was that?
No.
Okay.
The coroner's report is typically like we don't get to see that. We just get like a permit to bury and to process the
Mhm.
body. But the family will usually disclose information during funeral arrangements because it's a
Mhm.
very emotional time. So they'll,
Yeah.
they trust us and they talk to us. But no, we don't get to see the actual report.
Okay.
Mhm.
Okay.
Okay.
Got it.
Okay, Kara, just one thing. I'm sorry. No, no, sorry. It now is getting in my mind. This is so good. So, do you think the whitish thing is looks like the flame type of things, phlegm, or no?
It's stronger. You can't even break it.
Oh,
Okay, okay, okay.
So
It's not the
when
phlegm
blood
type.
clots
So
come
I'm
It's
out,
thinking if
almost
that is
like a
something.
cement.
Yeah, yeah. That's why I'm just thinking whether something is between lung to heart, something is going on. No, it's not
it's
like that.
that's
very
right, ma'am.
fibrous,
Yeah.
Okay,
like
okay.
very
It's
Mhm.
tough.
fibrous. Okay.
It's
Yes.
almost
Ah,
cemented.
aha.
Yeah, it's almost like a
Is that
stretchy.
platelet makes that one clot?
I
And ultimately,
honestly,
is it?
I don't know, but it's something that like I've never seen, and the senior funeral directors who were working with me, like they've never seen. And then on YouTube, there are a bunch of funeral directors from the UK and the United States who were reporting the same things, and they were keeping them in jars, like in formaldehyde, so that they could keep them
Mhm.
and show them like this is
Mm-hmm.
not okay.
Mm-hmm.
Yeah.
Wow.
Mhm.
Yeah.
Honestly, there was a lot of heart attack and even happening now. I know this girl, she was 20 something years old, but she got it from a blood clot. She went to the Brampton Civic Hospital with a blood clot. They sent her home, and the night she died. She passed
Oh.
Of
away.
course they did. Brampton is a
Yeah.
disgrace. Absolute
Oh
disgrace.
my gosh.
I don't know. They have opened
Very.
another new hospital. The whole Kennet Valley is always
Yeah,
overloaded.
it doesn't matter. It
Overloaded in the
doesn't matter which
Brampton.
one.
Yeah, in
It
the
doesn't matter which
Kennet Valley.
one. Don't take your people there. It doesn't matter
I
which
don't know.
one
They
in
said
Brampton.
if we die here. If it's 10 hours waiting, we're waiting here. They said,
No,
okay, you have your own hospital. You cannot take care of the Mississauga people. But no. And
no,
then if you
no.
say
I tell
something,
my
oh,
husband, I say, God forbid anything happen to me, take me across the border to Toronto. Then you can
Yep.
call the ambulance over there. When you reach at 401 and
That's
Western Road,
so
you can call the
far.
ambulance, and they will take you to
Yes.
Humber River Hospital. Yep, I
Humber
told him
Humber
That's
that.
River
very
is a
far.
good one.
Humber
Yeah,
River
Humber
is
River
good one.
Hospital.
Humber is good one,
Yeah,
I
Yeah.
guess. Yeah, Humber River
yeah,
is a good one. Yeah, yeah.
Oh yeah.
yeah,
Okay. Humber. Yeah.
yeah.
Mm-hmm.
Humber is very good.
Humber
With
is good.
patience.
Anyway, let us go to the class. You have exam tomorrow, but there is a lot of learnings. Thanks for Kara for sharing, and
Yeah.
also
Oh,
you know a lot
we're
of
so
things. I
sorry.
learned. I learned a lot of
Yeah.
things. That is the exchange. You know, learning is not one-sided. Learning is always multi-sided. You always get something, a lot of information
Mhm.
from when you discuss. So this is
Yeah, I
the
just have one
Yeah.
quick question for Kara as well. If your husband, he was blood group A, was he?
What was he?
Bl-
What? Sorry.
Group A, blood group
Oh, I
A?
have no idea.
No,
No
why you
idea.
asking that question, Yusra?
because I have read it somewhere
Yeah,
that blood group A are more susceptible to form clots. I don't know why.
really? I didn't know that
Yes,
one. Okay,
yeah,
so I'll check that one too.
yeah.
Huh? See? Okay. Mm-hmm. Okay. My uncle also, Pastor. He is a doctor. He's a huge famous doctor in Delhi, in the
Okay.
capital. He and his auntie both has the COVID. Auntie has more worse condition, but she stayed at home, but she recovered by my uncle being a doctor, taking all the precautions, taking care of everybody in the family, staying in home, house, and everything. He passed away.
Miss, there
Yeah.
is something about that COVID. When like what I used to do when I went within COVID, I used to be responsible for the list of everyone that works in the organization, their
Mm-hmm.
name, everything. And I used to be, because I was deployed. So I used to be that I have to call them up to get the COVID shot. And if they don't get it, that's where the firing process start if they don't take their shot.
Mm-hmm.
And most of the time, I'm telling you, the dignitaries, which is a CEO and those people, they don't
Mm.
take it. Their
No,
name is on
no,
the list.
no. They
They,
doesn't take it. They already
they don't
force
take
you
it.
people to take it.
Yeah, they don't
Exactly,
take it.
exactly,
Yeah.
exactly,
Their name was on
exactly.
the list, and if you call and everything, they don't take it. But
But
the
they For
The
them, there is
people
no
underneath
action.
them who they have to fire,
Yeah.
they fire 120 people at one time.
Yeah, so that's what I'm
From,
telling that for them,
sad.
they are not going to be fired, but they are going to fire the people who didn't take the
Yep.
vaccine within 2 or 3 notice. Anyway, those are so depressing. Anyway, I don't know. Yeah. Okay, so let us go back now. So what are the vital signs from where to you into where? But I learned a lot of things. Blood pressure, heart rate, and respiration rate, and body temperature. These are the 4 vital signs. Okay, so we always have the normal values. Normal values or ranges have been established for vital signs. We already discussed, people know everything has a normal value and seeing the whole population. And they also what is reported in a specific unit system so that whole world can stay in the same platform. Okay. So, and when is deviated from the normal value, we call this abnormal condition. If the body temperature is 36.6, if it is go for the 37, 38, 39, then we have the fever. If the the heart is pounding too much, high blood pressure, you have the pressure, high pressure, tachycardia, bradycardia, everything. Respiration rate is slow, you are having the SOV or you are having the slow respiration, everything there is a normal limit, normal value or normal range, and then anything deviation is called the abnormal condition. Why I'm telling, sometimes they give you the question, anything deviation from the normal is called what? Abnormal condition. Or they are giving you the normal pulse rate or heart rate and they give you a couple of options. Okay, then which is abnormal? So you have to do the which is abnormal that term, not the normal. So make sure, read the questions and answer always. Variation in vital signs may occur during course of any illness. If you have fever, if you have heart problem, if you have anything, so you can change. So as MLC, we should be alert to significant changes in the vital signs and report it to the physician who are working in the doctor's clinic. You may have to take all these vital signs. You have to monitor the temperature, you have to read the respiration rate, you have to check the blood pressure, you have to do the heart rate or pulse rate. And you have to document it, chart it. It's not like that I'm putting the hand in the forehead, oh, you feel warm. No, that's not the temperature. You have to really put the temperature, take the temperature, and you have to write it. You have to do the oxygen. This is also nowadays it didn't say that one. One of the vitals is included that if you feel breathing is the oxygen. Oxygen, you have to take the pulse and you have to do the respiration rate. So you should have to be familiar with normal ranges of vital signs. You have to know. Otherwise, if you doesn't know the normal range, how you are going to feel or say the patient is abnormal health condition. And also it's vary based on the different age group, anything medication or anything. Also, ensure equipment is in proper working condition to ensure accurate readings. And also how you are doing it, where you are taking the blood pressure, how you are positioning this sphygmometer. So you have to make sure that nowadays it's, everything is automatic, but still sometimes the doctors doesn't when there is any problem or anything or they cannot rely on that 3 readings are different, so they try to do by their own ear using the blood pressure cuff machine. So that you, I don't know how many you know how to do that, but if you do by yourself and you are really good in hearing the sounds, or diastolic and systolic, you can see the exact the value. So acknowledge factors that may affect vital signs, right? Example, exercise. Somebody came, exercise that came to you, it's normal. Their heart is going to be a little bit tachycardia. If there is emotional stress, you are crying or something, that means a chance of increasing your blood pressure, increasing your heart rate, increasing your respiration. Food and beverage consumption. If you take the coffee or something, alcohol or something, and then you coming, so there will be difference. So what are the different types of vital signs? One is temperature. What is temperature? It's not outside temperature, it's your body temperature. Who maintains the body temperature? If you remember, when you do the anatomy of the brain, we structure the what is called the nervous system. Nervous system. Who control the regulation of the body temperature? We have different parts of the brain. Those you have to go through for the midterm. Which part is responsible for which one? What does hypothalamus? What does the cerebellum? What is the different parts of the brain which is the main modulator of the different body functions? Endocrine system, thyroid, parathyroid, liver. Who I am going from one place to another place, suddenly schemes. Who is the diabetes related thing? Liver. Who secretes insulin? Who secretes somatostatin? What is the glucagon versus insulin? What is the type 1 diabetes? What is the type 2 diabetes? So go through all these searches. Okay, so now, so in humans, body temperature remains relatively constant regardless on the environmental temperature, right? If you are in the going too outside, body homeostasis is going to try to maintain your internal constant body temperature. But if you are in the sun or if you are too much -20 degree, -30 degree, do you think your surface or body temperature, you are standing outside and your body temperature is in the same? No. Body is trying by will try by homeostasis, so that if the body doesn't have the homeostasis, if you're staying in the -20, ultimately you are going to freeze. But body has the ability. We are standing in the bus stand when there is a tremendous wind. We have the freezing temperature -20, -25 till we survive. We are wearing the warm clothes for sure. But if our body doesn't do the homeostasis, if our body doesn't have that mechanics to do that, what is going to happen? We are going to freeze with the temperature. If you put the some vegetables outside, are they going to be able to maintain their temperature? No, they are going to be frozen. So in humans, body temperature remains relatively constant regardless the environmental temperature. Temperature, how it maintains? It maintains a balance of heat produced in the body and heat lost from the body. Obviously, if this is too hot, they are going to lose the body, and when it's cool, it's going to produce the heat. And heat is coming, how is generated? Is from the energy metabolism from your body using the ATP, adenosine triphosphate, what is the energy source. And how it comes? It from the glucose breakdown. So temperature maintained through a balance of heat produced in the body and heat lost from the body is a balance. That is the homeostasis. Constant temperature range must be maintained for body to function properly. If the temperature one time goes 32 degrees centigrade, one time, okay, in the morning temperature is 32 degrees centigrade. But because I sleep. In the daytime, I am working is 37. Do you think it's going to work? No. Body has to keep the constant normal temperature in range so that not only you are working the daytime means you are working for that, but your body, your whole system, whole body physiology is working. And that physiology to keep you alive and functional and healthy, it needs a constant temperature in a range. In general, is 37 degrees centigrade. So constant temperature range must be maintained for body to function properly. When is heat produced? It can be produced through the voluntary and involuntary muscle contraction. What is voluntary means? You are controlling the movement. You are doing something. That's why it's the voluntary. And involuntary, person cannot control. Means when you are eating something, you are breathing, you are shivering of the heart. So that is the involuntary. That is not under your control. When you are eating, the body needs to function little bit. The digestive system needs to function little more. Stomach has to do good peristalsis. It's not the regular one. When you are eating, it's doing it. So stomach has to do the peristalsis from esophagus. Food has to go from mouth to food has to go to the esophagus. Esophagus to the stomach. Then stomach to the they have to they are doing extra function. So that is the involuntary. And shivering, if you are feeling cold, shivering means the body is trying to combat, to do the homeostasis to generate your normal body temperature. So you have to remember, so what is the voluntary and involuntary. So now there are something involuntary, cell metabolism, fever, strong emotional stress. These can all lead to the temperature rise in the temperature of the body. So heat loss through the urine. How you lost the heat? Through urine, through feces, water vapors from the lungs, your perspiration, radiation conduction and convection. Okay, so these are the same is the conduction, because what is conduction? You are touching food in the floor, so the heat is going. If you are have a cold, what is called the marble floor, if you touch the marble floor, you can feel that is cold because your body is heat. So that heat is going from here to there. If you sit on a chair, you can see when you get up, the chair the is little the sitting area of the chair is hot because your body is conducting heat. Radiation means when it's going out from your body. Evaporation is from the lungs. And due to the air motion is called the convection. Who is that? And this is the voluntary one. Just give me one thing in. Okay. So what is the body temperature range? Body temperature range is there, but it's a different area from where we are taking the temperature. It should not be the same like oral versus ear versus armpit, rectal and forehead. Generally, we deal with the oral, and sometimes who cannot be taken oral, we use the armpit. For the kids, basically we use the ear or rectal. Sometimes for some patients or who has a really high fever or continuous monitoring, sometimes they have to use the forehead thermometer also. So oral temperature ranges, you have to remember that 36.4 to 37.2 is the normal, and you have to remember either you can convert later when you are knowing the Q and A math, so you can immediately convert to the Fahrenheit temperature. In general, this country, Canada use this one, USA does this one. So different countries either use the centigrade system or the Fahrenheit system. It's okay if you can remember 36.4 to 37.2. You cannot remember this one, but you know the formula in case they ask you the normal body temperature in Fahrenheit. So if you know the formula, you can immediately calculate it, or you have to remember both. Here is little bit less. The questions come where you can get the highest normal temperature range. That's the rectal area, 37.0. This is the normal for the normal temperature. For the rectal, when this temperature you are taking in the oral, if it's 38.81 means it's fever. Because rectal area is highly vascularized and very closed. That's why it gives you the highest temperature. Okay, so if you see the 100 in the body by the oral or armpit or ear, oh, that means we are almost having the feverish or fever, starting the fever. But when is in the rectal, that is okay, acceptable. So oral is 30 centigrade, 36.4 to 37.2. Ear is little bit less, 35.9 to 37.6, but the range is more. Armpit, that is the lowest we receive, 35.2 to 36.9. So average you can see, that's why I said the normal body temperature is week is 37 degree, because you can see everybody in the range of 37. There is a value 36.9 means 37. So 36.6, 37.6, 37.2, starting from 37, it's 36.9. So basically, 37 is the average normal body temperature, but the ranges are different for different regions of the body. So normal temperature of human rectal temperature is 36 to 38 degrees centigrade or 97. For oral or core body temperature is 36 to 37 or in Fahrenheit. So you have to remember the values. It's not coming in the question. Alternation in the body temperature. What is the name, medical terminology of the fever? Is called the pyrexia. Pyrexia is fever. When is body temperature is above 38 degrees centigrade? That is equivalent to 100.4 degree. Heat being produced is greater than the heat being lost, because your body is losing somehow some infection or something, so you are producing more heat than the heat loss, so homeostasis balance is disturbed. Low grade fever 37.2 to 30, when the this is a little bit, little bit feverish, that is called the low grade fever. Temperature 37.2 to 38 degrees centigrade. That is the low grade, 99 to 100 degree. Hyperexia above 41 degree. Hyperexia. Low grade fever. Pyrexia is the fever. Low grade fever and hyperexia when the temperature is 41 degrees centigrade. This is a serious condition. And if the body temperature goes above 43 degrees Fahrenheit, it's fatal. It's fatal. And as we are having the fever or body temperature, there is also the reverse side, is the less body temperature, which is called hypothermia. Another terminology for when the body is too hot is called the hyperthermia. Hyperthermia is caused due to fever, due to sometimes physical exercise or something. Hyperthermia can be caused, but fever is hyperexia when you have the fever. And hyperthermia, when your body is hot, you are in the outside for sun for a long time, you are doing too much stress, that's for the transitional, or maybe due to fever. So hypothermia can covers everything. And hypothermia is below the body temperature 36.1. What you are going to feel difficulty if the body temperature, when you are drawing the blood, if you the patient have the hypothermia?
The blood will not flow.
Not flow properly. It's very slow. Yes, very slow, and it's going to. It's hard to feel the pain also because body is so cold.
Be viscous.
Yeah, it's very hard to feel the pain also, and the body. That time, what we do is a hypothermic patient. Are you going to use the vacuum tube for
Warm it up.
collecting the blood? What you are going to use?
Oh, a
I
warmer,
think
like
warm,
42 degrees centigrade warmer
Okay, you
to
use the
apply
warmer
on the
till
fingers.
the body it doesn't blood is coming properly. How you are going to collect the blood? And if you doesn't have the warmer, you
You
went to
can
the
use the
bedside,
syringe,
Use the syringe.
butterfly and syringe.
butterfly with
Yeah.
syringe. Yeah.
Butterfly and syringe. Yes, sometimes you are going on the from the floor. You are going on the floor. You doesn't know. You are not prepared with the hot pack. If you get it from the hot water or something like that, sometimes still we put the hot packs and then syringe. It's so cold.
Yeah.
Okay.
You put the
Yeah,
hot pack down or the up on the, and then we try to slowly syringe it. Okay.
Mom,
Yeah,
there's a
mom,
typo error.
can do massage.
Yeah.
Is can do massage.
Yeah. How long you are going to do it, dear? You have two hands. You have to take the blood. Are you going to massage like the finger puncture and do the blood? You can do the little bit massage. You can put the tourniquet. But if the body is really hypothermic, if you massage a little bit, then it's the flow is not going to be the same.
Mhm.
You can do
Okay.
that one. You can put the warmer, heat warmer. It's also the same thing. You just try to maybe little bit helpful, little bit helpful. But sometimes if it is really hypothermic, it's very glad to get the blood flow. Even you put the tourniquet, it become more worse. So you have to put the tourniquet not too tight. It depends upon that will that's all not, is go plus and plus. So whenever doing the blood work, you have to see what is happening. If I put the tourniquet too loose, the blood is not coming. It's a medium, whatever I should tie is working. It's not, I'm putting the tourniquet a little bit more, but see how the blood is coming. You can do the massage. But massage is temporary. You cannot do your hand. You can engage your hand. You are doing the collect. So sometimes it happens. You put any warm pad or something below the area where you are taking the blood. So that area is a little bit warm and a little bit flow a little bit even in the syringe. Because in the syringe it's also starting getting very difficult. You can feel the resistance. Not the blood is not coming and
That's
the ear
true.
may comes. Yeah, so that's why that's happened if you put the warmer. But if you doesn't have anything, you are going to put small needle so that the is slow. At the same time, you have to do the syringe with the butterfly. Okay, thank you.
There's a typo error, ma'am. Hyperpyrexia, generally fatal if it is above 43 degrees centigrade, supposedly, I guess.
So fatal if above
Degrees
43 degrees
Fahrenheit.
centigrade. Yeah, that's what is the typos?
Typo. Yeah, ma'am.
Where?
Mom, the blood.
The
Yeah.
F instead of C.
Yeah,
Oh,
that's
Sorry.
yeah,
ma'am.
yeah, yeah. Oh, good,
That's
good, good, good.
Yeah, the
Oh,
Fahrenheit.
yeah, 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 yeah.
Sorry, Mom. The
What?
blood flowing too slow is we talk about the hypopraxia or hypo.
Blood is flowing? What? I didn't get your question, dear. Could
Sorry.
you please repeat it?
Yeah. We just talk about who has a serious condition. So it's we talk about the
There
hypo.
is no hypoparexia. There is hypothermia. There
Oh,
is
okay,
no
okay, got it.
hypopyrexia. Pyrexia is fever. There is nothing hypopyrexia.
Okay,
Hypothermia or
hypo,
hyperthermia.
hypo.
Hyperthermia is body temperature above normal. It can be caused for anything, but fever is the rise of body temperature for some cause. And hypothermia is the
Hypo
when there is the body temperature is below normal. That is
below normal.
below 36.1 degrees centigrade.
And blood flowing is slow, like slow.
Obviously, yeah, yeah. If
Okay,
the okay,
thank you.
blood flow can less for another thing. Tell me what?
Sorry, ma'am, what's your question again?
Your blood flow can be, you may not get the same pressure with the blood flow when you are taking the blood. What may be the
Yeah.
another cause?
Thick. I mean, probably high RBC.
High RBC is okay, but that is not regular.
Uh,
If you're cold,
I don't know, ma'am.
Are you already told you are called the hypothermia?
Hypothermia.
It's cause the blood clotting.
No, it's a normal person. Why is the clotting? No, no clotting abnormalities or anything.
low blood pressure.
Exactly. Exactly. If it's
Oh,
too low blood pressure, blood will not getting flow in the same way like the cold one. It's going to be very slow. Temperature will be same, but the flow is going to be really, really less. Okay? Very good, Kara. Thank you. So I have to send it to them. So, share. What is share? What? Why is happening like this? What? Hmm. I'll take care of this one. So this one, okay.
Mommy, you can go to file.
File then?
Save us.
No, I like to group it before that. I'll
Oh.
save it's not saving. I like to group all those, but it's not allowing me to group. Like you can group these two, but when I want to group,
Mhm.
it did it. Oh, why is going up outside?
Yeah. It's tricky.
Okay. Nope, there is something wrong. Okay, that I deal with that. At least I beat the information is with me. Okay. Okay, so this was done. Okay. So it's variation in the body temperature. It can be with the age, diurnal variation, exercise, emotional states, environment, pregnancy. Because in pregnancy, cell metabolism is higher because mom is taking care of the baby. So it may be little bit high temperature. Who is writing the note? I'm online hearing. Who is that? Who is that? Oh, okay. Okay, so obviously age, infants are always super active. Young children, they have the higher temperature. Adults and elderly adults, which are not doing anything, basically their basic metabolism rate is going slow down, so they may have some lower temperature. Diurnal variation, because in the daytime you are more active, right? So that is not a huge like the 37 versus 35. There is a little bit variation in the diurnal temperature can happen. That is the time of the day, your sleep and wake cycle. During sleep, body metabolism and muscle contraction slow down. So causes the temperature to lowest in the morning. So morning the temperature is low because you are calm. Okay. But there is no that much. There is activity, basal activity is going on. That's why you're surviving, you are alive. But not like you are not eating food, you are not drinking or anything. So body has little bit okay. I don't have to do all those things. So once you do one job, whole body system needs to function. Right? You are digesting the food, then you are making the nutrients. The blood has to take all the nutrients here and there. Then you test the gases exchange. You have to do this and that. So everything is like that. So, but when you are sleeping, everything basic metabolism rate is slow down, but the metabolism is there. Okay. So that causes the temperature to be the lowest in the morning. exercise. But who doesn't have the proper sleep? Do you think they are going to have the temperature in the morning low? No, because they are not sleeping well. In the things they are disturbing their body metabolism rate. Exercise, yeah, exercise. It increase involuntary muscle contraction because you are doing exercise, right? It's not the normal, so it can give you the heart temperature. That's why you start sweating because the body wants to do the homeostasis, because when you do exercise you are producing a lot of heat, and then body wants to lose the heat. How is going to do that? Body wants to make the normal balance. Body starts sweating so that the heat can be lost from the body to make the homeostasis. Emotional stress such as crying, extreme anger increase the body temperature. If you cry too much, my face is red, I'm feeling hot. Even anger for sure. Yeah. Especially the anger when if you can express it or tell something, you are feeling more hot. Environment. This happens to a lot of ladies, right? You cannot say anything to anyone, but you are, environment. Obviously, we discuss about that pregnancy. Assessment of body temperature. You have the body temperature, you are feeling it, but we are going to assess. We already know we can get from the mouth, we can from the axilla. Axilla is under armpit, it's called the axilla. We can take it in the rectum and ear, and maybe sometimes in the forehead. Site should have an abundant blood supply. The area where you have the blood supply, good blood supply, only take the blood pressure from the, body temperature from there. So, and site must be as close. The close environment is going to give you the more perfect results because there is no disturbance from the other outside factors. So, mouth, when you are taking the temperature in the mouth, you have to tell the patient to close the mouth but not chew the thermometer bulb. Mouth, axilla, you have to close the axilla after you put the thermometer. Rectum is already closed. There is an ear, you have to put the probe in such a way inside the ear, but that is less. That will be ear is that's why a little bit less, but till the ear cavity is more closed. Site chosen depends on patient's age, condition, and state of the consciousness, type of thermometer available, and medical office. Who is unconscious patient? Are you going to put that one in the mouth? No. You never know whether they can break the thermometer bulb and mercury can go inside. Either you can use the forehead or you can use the axilla. For the very, very young kids, sometimes we put in the rectal area because ear canal is so small. Maybe sometimes it's hard to get the thermometer probe there. And also what type of thermometer you are using, which is available. You have the thermometer which can measure the temperature oral, and the same thermometer can be used at the axilla or rectum, that's fine. Sometimes you have only the ear thermometer. So you cannot use that ear thermometer for taking the temperature from your mouth or for the axilla or for the rectum. For the rectum and mouth, we never use the same things until you change the probe. Or you have a separate one because these are the two separate, different, very sensible sites. Oral and axillary temperature. Oral, convenient and one of the most common routes. Reach blood under the tongue. You have to put the thermometer because there is the maximum blood supply. That's why you have to put under the tongue, in between the teeth and under the tongue. So patient must keep mouth closed to provide a closed space. Patients should avoid any hot or cold drinks for at least 30 minutes. If somebody take the coffee and you are taking the temperature, hot drinks, or somebody taking the some ice cold soda, something, there will be less temperature. Because the body needs couple of time to adjust it. So minimum 30 minutes. See, you are good putting the bulb here. Everybody does that. Everybody take out and then you have to close. Auxiliary temperature recommended for toddlers and preschooler because they are so naughty, they cannot understand. They can chew the thermometer bulb. So it is recommended for toddlers and preschoolers. It is not as accurate as other side use temperature. Your rectal is very what is called accurate. Your oral is accurate, forehead also accurate, but the axilla is not that close like the other areas, not vascularized, not the other areas. But what you have to save the kid, right? So that's why you do the axillary, and also sometimes unconscious patient we do the axilla and also in the forehead. So how you are going to put it? Put it in the depression of the armpit, and there you are going to close the hand like this so that you can take the temperature. Rectal temperature, highly vascular, provide the most closed cavity, recommended for infants, unconscious patient, mouth breathing patient who do the mouth breathing, because who takes the breathing from the mouth. So you cannot take the mouth temperature, because even for 1 minute the patient will feel they cannot breathe because they are breathing through the mouth. Should not be used in newborn, danger of rectal trauma. Okay, so the rectal area is a newborn, you cannot use it. That is the thing highlighted. The rectal temperature cannot be taken in the newborn because danger of rectal trauma. The top of the axillary oral thermometer below is the rectal temperature. So when you are taking the rectal temperature, the thermometer probe is like that, and from the axillary it is more cylindrical. And this is yes.
I have a question, Miss.
Yes.
Are these thermometer are the one with the mercury in it?
This is the with the mercury.
Okay, good.
You can, that is the bulb. The bulb is there. That is the mercury.
Okay, good. Thanks.
Okay. So oral is the ER. You know the terminology. Oral means ER. So it's called the oral temperature or the temperature, the oral thermometer. Sometimes it may not tell you the ER temperature. It's called the oral temperature. It's commonly used mainly for the kids' closed cavity, and that is easily accessible and more comfortable for the patient, especially the kiddos. That is the temperature. Pulse. What is pulse? When the left ventricle of the heart contracts, blood is forced into the aorta. You know what is aorta means, right? It's going from the left ventricle to which valve?
Mitral.
What?
Aortic valve.
Oh, the aortic.
Yes.
No.
Mitral
Aortic
valve.
valve.
Mitral valve. Mitral
It's
valve is
between,
bring
Ma'am,
the
sorry.
blood from the left atrium to the left ventricle.
Exactly. Yes, yes.
Yes. So then you are the aortic valve. When is going to aorta? Aortic valve. When is going to the lung? From the right ventricle is the pulmonary valve. It's easy to. It's going to the.
Yeah.
Everything is nomenclature has a meaning. So it's going to the lung, the pulmonary. So it's a pulmonary valve. And this one is from left ventricle is going to the aorta. So it's aortic valve. Easy to remember. Okay. So when the left ventricle of the heart contracts, blood is forced into the aorta. Aorta must expand to accept blood from the left ventricle because heart is pumping. So aorta has to have the capacity to hold that blood which is coming from the left ventricle, and that sudden flow, like the whole garden hose pipe, when you first open you got some pressure, right? The same thing is happening. Heart pumping, blood is going, getting the pulsating wave. When it's going suddenly, it push contract, it flows the blood, it's going to the pulsating wave, and which travels from the aorta to the walls of the arterial system. That wave is known as the pulse. It can be felt as a light tap. How you are measuring the pulse rate is measured by counting the night taps or beats per minute. You can do in different places. You can see in the wrist, you can see the carotid pulse, you can see in different, sometimes they have the femoral pulse. So, and how you can determine how much the pulse rate means heart rate. That means how many times ventricle is pumping the beats per minute, that pulse is generated from the blood who is going out from the ventricle to the aorta and ultimately to the total arterial system. Agree? Agree, yes or no?
Yes, ma'am.
Understand?
Yeah.
Only Evelyn understand.
Yes, miss. No, my
Yes,
mic was
ma'am.
off.
Yes, miss.
Okay. So now what can be like the temperature can affect for the different factors? These are all known factors, just refreshing. What affects the pulse rate? Obviously age. Age increases, pulse rate decreases because less metabolism, less activity, right? So pulse rate should be decreased. Children, unless you have a high blood pressure or some kind of problem, that's a or tachycardia or something. So if you have a tachycardia, the pulse rate will be high. So in general, in the normal, if the age increases, pulse rate decreases. Children always have a higher, faster rate than the adults because they are super active. Physical activities increase pulse rate like the heart rate or the body temperature, but it's a temporary. Anything rise for the physical exercise or emotional stress, those are all temporary. So those rise of the body temperature or the pulse or anything doesn't consider as a disease. Hypothermia caused due to the exercise, hyperthermia caused due to the exercise is not a fever. Same for if the high pulse rate, if you have tachycardia due to exercise, that's not a disease. That is due to the certain event that is temporary. Emotional states, what type of emotional states you can have? You can have anxiety, you can have fear, you can maybe excitement, like you guys are very excited for tomorrow's exam. So if you
No.
just, or maybe you have the anxiety, who knows which one.
And
And right
more
now maybe the
anxious.
more emotional state, and maybe
Always,
you are
mom, always. Anxiety.
you maybe agree with me. Moon is there teaching us so much. So there are different type of factors can increase the temporary pulse. So also the gender, metabolism, fever, medication that can also, that is from the problem. Gender, women tend to have faster pulse rate than men because men are always driving the crazy, right? So women has tend to have faster pulse rate than the men. Am I right? Men all drive the woman crazy, right?
True.
That's right.
I'm just joking. So women tend to have faster pulse rate than the men. That is for their hormone cycle. Metabolism. Increase body metabolism increases the pulse rate. Example, pregnancy. Fever increases pulse. Everybody knows that you can feel the pulse. Medication. Some medication may also increase or decrease pulse depending. What are the different pulse sites? The best one is the we took is the radial artery. That is some very commonly you use this one. Okay. Here also you have a pulse. You can feel it, but this little bit deep inside. That's why we can feel with the what is called the blood pressure machine. When you cannot get the good pulse here, sometimes low pulse, sometimes you can go to the common carotid artery. It's very hard. There is this one, but it's not easy to get the feel the pulse here in general until you have a heavy high pulse rate. And this is the superficial temporal artery. You can see you have a very bad migraine and you can feel dipping in your head. Sometimes you feel the pressure there. That is for the superficial temporal artery. Most common site is the radial artery. When people come from the VSA something, we doesn't have the pulse, anything, the last one you can see the femoral artery. And these are also different areas you can feel the pulse. It's called the dorsal pedial. The sides you can get the pulse. Popliteal artery, did you feel it? I never feel it. But anyway, pulse felt most strongly when superficial artery held against a firm tissue. So that's the area where the artery can be pressed back on the firm tissue so that you can feel the tap. So when you are doing the radial artery, you are holding the hat and you are pressing the artery against on the wrist, so you can feel a tap, 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 tap. Common carotid artery, that is also easy. Some people can do that very good. But I am not good at that. Somehow I cannot feel it. Basically, we do the either the radial artery or in the common carotid artery. Okay, assessment of pulse. You guys know palpation used to look at pulse. Apply moderate pressure with pads of 3 middle fingers. Do not use thumb. Assessment of the pulse includes pulse rate, rhythm, and volume. Okay. Number of beats in 1 minute. What is the pulse rate? In 1 minute, you are going to count how many times you are feeling this beat or the tap tap. So it's called the minutes, beats per minute, whether it's the heart or it's the pulse. Pulse is the representation of the heart rate. Normal range, you guys know 60 to 100 beats per minute. Tachycardia more than 100, bradycardia less than 60. Pulse rhythm and volume. Pulse rhythm, time interval between heartbeats. Normal rhythm, same interval between beats. You can see deep, 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 deep. Is the dysrhythmia, also known as the arrhythmia. Sometimes your interval, you can see deep, 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 deep. So that is the difference of the timing. The each heartbeat is not in a rhythm, proper normal rhythm. That is called dysarrhythmia, not in normal rhythm. Is also called as the arrhythmia. Sometimes is the tachycardia or bradycardia is not related to the dysarrhythmia. Bradycardia, it may be equal, slow but equal. Deep, 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 deep. Tachycardia, deep, 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 deep. But those are normal rhythm is tachycardia or bradycardia. But dysarrhythmia is deepening. Deep, 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 deep. So that is kind of, I am just telling you like this. This is called the dysarrhythmia. So rhythm is normal. That may cause when if the heart falls one beat, miss one beat, or two beats, or timing. That's the complex arrhythmia. It can represent on the, you remember, right? When we are trying to describe the ECG, complex arrhythmia, so it's not normal. So different times, period, going, it's not normal. Pulse volume, strength of the heartbeat, is a pounding pulse or is a weak pulse. So when the normal pulse feels strong and full, when you have low blood pressure or you have the bradycardia or something, you can see the pulse is very feeble, very slow. You doesn't have the. So sometimes pulse is like boom, 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 boom. So that's the boundy pulse. There are different types of pulse. That is called the volume. Now we are going to the respiration. What is the purpose of respiration? The purpose of respiration is exchange of oxygen and carbon dioxide between the atmosphere and the blood. So one complete respiration means one inhalation and one exhalation. Even this is under the your vital signs. This has been we learned in your respiratory system. So these questions are common. It's not like that. We did it in the vital signs. This is optional. Means this question may not come because you have already learned it in the your respiratory system in the anatomy. So one complete respiration means one exhale and one inhale. You are taking inhalation, you are exhaling it. So it's a total, is complete in respiration. In the other word, one complete respiration has two parts, inhalation and exhalation. What is the external? This is very common questions also comes. What is the, we have did it in the anatomy and physiology, in the review, there is question you guys answered. What is the difference between external respiration and internal respiration? External exchange of oxygen and carbon dioxide of the alveoli and blood. Alveoli in the blood. What is the parts of the, what is the alveoli? What are the alveoli?
They're like little sacs in the lungs.
Yes, 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 yes. Very good. Yeah, this is a spongy sacs in the lung, where the main gas exchange takes place. Okay, where the gas exchange takes place between the blood and alveoli. Blood is coming through the veins and arteries, this flooding, the sacs, and the air gas exchange is taking place. So external expression between the alveoli and the blood. In the alveoli, what is external? Inside the alveoli, oxygen is coming through your inhalation. So it's from the external, air is going inside, right? You are taking a deep breath. You are inhaling. Oxygen is going and filling your alveoli with the oxygen. And the blood is bringing the deoxygenated or carbon dioxide blood, and then they exchange. Okay, so blood cell, the alveoli. Okay, give me the oxygen. In exchange, I am giving the carbon dioxide. Alveoli said, okay, this is my job. I can do that. I am giving you the oxygen, but in exchange, you have to give me something. So blood gives the carbon dioxide. Alveoli happily take that carbon dioxide and release in the air as an exhalation. So that is the external respiration between the lung and blood, or lung alveoli or the lung. And internal respiration, what is happened? That is the tissue metabolism. You need in the tissue that is going. Blood is carrying the oxygen everywhere in the body, in each cells, not only your digestive system or nervous system or your circulatory system or your what is called urinary system. Each system down the road in each cell of the body. And they are in cell also doing some activity, right? The cells are also doing their activity. They are taking the oxygen to cook their metabolism, that is the cook. Whatever they need to do the work, job, say for example, kitchen, you need the oxygen. So they are doing their job using the oxygen. And when they are using the oxygen, they are producing the carbon dioxide as a byproduct. There are other wastes also that you learn with the different system, that you can say urea, uric acid, ketone. There are a lot of other things which is toxic our body is generating. So that is also getting transported from the blood. But in case of when you are dealing with the respiration, we are more concerned about the oxygen and carbon dioxide exchange. So in the external respiration, we are taking the oxygen inside from the alveoli and carbon dioxide getting out from your body or from your blood to the outside. Internal respiration is the exchange of water and carbon dioxide between body cells and blood. So here what is happening? Here blood is giving you the oxygen to the cells, and in exchange cell is giving out the burned out carbon dioxide dumping in the blood. So there is the just different external and internal. Internal respiration between the body cells and the blood. External respiration between the alveoli of the lungs, which is full of oxygen, or the air with the blood. And opposite of exchange, external oxygen is coming inside the body from the lung and carbon dioxide getting out from the blood. Whereas in internal respiration, oxygen is coming to the tissue or the cells from the blood. Blood is giving the oxygen to the tissue, and tissue or cells are giving the carbon dioxide in exchange to the blood, so which is getting carried out and going to the lungs. Is that clear, everyone?
Yes,
It's
Miss.
clear.
Yes.
Okay. So difference between external and internal respiration, and what steps happen one has been in and out of the oxygen, and they can give you the question: external respiration, oxygen and carbon dioxide. Oxygen is going out from the body and carbon dioxide is in. Is that true? No. External respiration, oxygen is coming inside the body and carbon dioxide is going to leaving from the blood. Internal respiration, oxygen is coming from the blood to the cells. Once again, I'm repeating because these questions people made mistake. Always make mistake between the internal and external respiration. So internal respiration is between the blood or circulatory system or the capillary versus your cell or tissue. So cell did their work, function, they have the carbon dioxide there. When the blood is coming, which is full of oxygen from your arterial system, then what is giving the oxygen is delivering to the tissue, and the carbon dioxide generated inside the cell or tissue, they are getting back to the blood.
So
Assessment of the
oxygen, sorry, Miss. So the internal respiration, you're saying that the oxygen is coming from the blood to the tissue?
yes,
Okay. All right, got it.
and carbon dioxide going out from the cell or tissue to the blood is just the opposite for
Yeah.
the external. Okay, okay, okay. So assessment of respiration. How you are going to assess? How you are going to measure the respiration? Always measure the respiration without patient attention or patient knowledge. Otherwise, the respiration is going to change. If I look at you, tell that I'm going to the respiration and I look at you, how your chest is elevated or depressed, is going to be false result. So whenever take the blood pressure, when you are doing the measurement of the pulse at the same time, we just look at the patient respiration rate. Because if you pay the patient knows that you are taking the respiration, they can control the respiration in non-intentionally. So you have to take the measure the respiration without patient's knowledge. Ideal time is after pulse is taken. When the pulse is taken, you can just look at that. We say with the same time, we measure the pulse, what is going on, and we look at the patient, how much their chest is elevated or depressed. So what is the normal adult range? Is 12 to 20 respirations per minute. So it's a ratio of 1 respiration for every 4 pulse rate. So if is the respiratory rate is 18 per minute, 18, 1 minute, that is respirated is 18, then the pulse rate would be 72 BPM because 4 times protein. So sometimes if you cannot take the pulse, they calculate it like that, pulse rate. At the same time, if you cannot get the respiration, so this vice versa. So if you measure the respiration is 18 times. If you can multiply it by 4, you are going to get the pulse rate.
By 4.
Times multiplied by 4.
Oh, because
The
every 4 pulse
res
beats. Okay.
yeah,
I got it.
yeah, yeah. So if you multiply the respiration rate by 4, you are going to get the pulse rate.
Yeah, got it.
So, for example, sometimes it happens nurses forgot to take the pulse rate, but they were busy, but they took the respiration. What they does, they multiply that one with the 4 and put the pulse rate.
Yeah.
Okay. So normal respiration rate is 12 to 13 beats per minute, not beats. Is coming always beats. Is the per minute. How many your chest elevation and depression is going on? We just calculate that. Tachypnea, abnormal increase or more than 20 minutes. When you have SOB, when you are doing the exercise, is going to have a more faster rate of respiration, right? To get the more oxygen in your body. So it's called the tachypnea. And bradypnea is the less than 12 minutes per hour. So while is high and less, tachy means high, brady is less. So tachypnea and bradypnea is related to your respiration, not your heart, like the tachycardia or bradycardia. Don't get confused with that one. Tachycardia is related to the heart, cardia, bradycardia. Tachypnea is related to the respiration. It's more respiration, higher respiration rate. And bradypnea is the lower respiration rate than the normal rate.
But there's still the increase and the decrease.
Obviously, everything is going to be increased. Your even the body values, your electrolytes can be increased or decreased.
Yeah.
Your cholesterol can be increased or decreased. That is the problem, your health problem. Otherwise, everything is normal. You are normal person. When you have health problem, there will be something increase or something decrease. So, what are the different terminology associated with the rhythm and depth of respiration? Eupnea means normal respiration. Anything U is normal. Eupnea is normal respiration. Hyperpnea, abnormal increase in the rate and depth. Okay, hyperventilation, abnormally fast and deep breathing. Hypopnea, abnormal decrease in the rate and the depth. Okay.
Ventilation.
That means you are hyperventilating, you need more oxygen. Okay. Respiratory abnormality, a reduction in the oxygen supply of the tissue. Hypoxia. Oxia means there is less oxygen. You know, oxygen is coming from the oxia. And hypo means is less. Reduction in the oxygen supply of the tissue. If you are in the high altitude, you may have the hypoxia. If you have some problem in the heart or anything, so maybe you are feeling a reduction, oxygen is going, so that means you have hypoxia. So reduction in the oxygen supply to the tissue. Cyanosis. When there is cyanus, is a bluish coloration of the skin and mucous membrane, and which is first observed in the nail beds and lips, because those are the extremities. What happens when the blood doesn't go properly to reach the extremities? Slowly, there is less oxygen, less air, so it started making bluing of the skin. So that is called the cyanosis. That means the extremities are not getting enough supply of the blood for any reason, and the blood is started clotting there. That's slowly starting like the cyanosis, first blue, and then it slowly turns out to the more darker blue. That is called
Miss,
the, yes.
so what caused the clotting? Is it because it's so cold?
Sometimes it's cold, sometimes your blood circulation problem,
For circulation.
poor circulation, maybe heart, when the heart cannot pump you too
Hmm.
much low blood pressure. There are a lot of factors.
What
Okay,
about high blood pressure? No, just low.
low, high blood pressure, until and unless you have some problem in the extremities, some block or something, there will be no problem. But you have any
Yeah, 'cause I get that
blockage,
every. Yeah, I get
yeah,
that every winter. Every winter, I
yeah.
get that in my fingers.
When you are outside,
Yeah,
yeah. So
most of the
that means,
time.
yeah. So you have to wear good gloves, very
When I
good
Yeah,
get
gloves.
cold,
Yeah.
when
yeah. When
it's
it's very
cold
cold.
temperature.
Yeah, you can see
Yeah,
sometimes if you are in too outside is freezing cold and you come inside, you try to wash your hand, you can feel pain,
yeah.
because you can feel pain. So even and especially if you put the hot water, is most worse. So
I use
because
the
those,
alcohol. I
so
use
those
rum.
yeah, running, I saw that if you put the, for making it warm, if I put the hot water, it's more painful. So
It's
slowly I turn it from the normal to the hot water, because those areas blood is not, the tissue and muscle tissues are not getting the enough blood flow.
yeah.
So that's why I started pain. And if it lasts for a long time, then it started the cyanosis.
Yes, I use rum like alcohol.
Oh, really?
Yeah,
It
and it
makes,
warms it
oh,
up.
oh,
Yeah,
wow.
my mom taught me how to do
Oh,
that.
I didn't know that. I didn't know
Yeah, I
that. So
use the
any alcohol.
alcohol,
Okay, okay,
the rum,
okay.
and just yeah, I put
That's
it
good.
between legs.
That's good. Another use of RAM, right?
Yeah.
Another benefits of RAM. Okay, good. Okay, next is dyspnea. Anything this means difficulty. Difficulty in breathing or shortness of breath is called the dyspnea. An orthopnea condition in which breathing is easier when an individual in a sitting or standing position. Maybe when you are lying, you are having problem in the breathing, or if you are standing, you are having difficulty in the breathing. So orthopnea is in a position related breathing. So you want to go for break and then we complete the blood pressure, or do you want to complete it and then go?
Let's go for a break, ma'am.
Okay, go.
Thank you.
Welcome.
Okay, thank you, Miss.
Thank
Okay,
you,
dear.
Miss.
Okay. Okay. So it's 117. So almost 20. So we are coming by 30 minutes. So 11:50 you are back, right? Almost.
Yes, Miss.
Okay.
Yes, Miss.
Okay. Enjoy your break.
Thank you.
Thank you.
Thank you, Mom.
Sabana, what happened to you? Why you are sick every day?
Yeah, ma'am, can you hear me?
What happened? You are sick? Why? What happened?
I think every time like I get it from my kid, he's a little unwell, so he gets it and then I get it because he sleeps in the same bed as me.
Yeah.
I think
So
it's
he is
just
okay
that.
now, right?
He's better. He's over here with me too.
Okay.
Did you say hi?
Hi.
Hi, how are you? What is happening with you?
Okay.
Joanna has a dog?
Yeah, Jonah has it. Look, she's your doggy.
Oh yeah, I'm allergic to dogs.
Ah.
I'm
Yeah.
also allergic to dogs.
Yes, you're
Oh,
allergic to
hello,
dogs.
hello,
Mhm.
buddy. How are you? Joanna,
Good,
what is his
good.
name? What is his name?
Kobe.
Kobe? He or she?
He.
Okay. Ah,
He's a he.
I have a dog too. Yeah. You can
Cute,
probably you can hear his
I'm,
voice sometimes. He comes and talk to me.
I'm allergic to dogs.
You are allergic to dogs? Oh, sorry to hear that. But the dogs are beautiful. Dogs are pets are beautiful.
Yeah, they're cute,
They are
right?
your life.
Yeah,
Yeah.
and they protect you.
And they
Yeah.
protect you. That's right.
Oh my God, they protect you, right? Yes, very good. Okay, no problem.
Mm.
Okay, enjoy your break. We'll be back.
Thank you, ma'am.
Thank you, Miss.
Say bye-bye, Susan.
Bye bye.
Oh.
Bye bye. Eat well, okay? Eat well, okay? Bye bye. 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 Mhm, mhm, mhm. Yeah, hi, this is Munmun Chatterjee. I called you two, three times to get an appointment with Dr. What is, I mean, after the injections, nobody, I am feeling so much pain. They say, you guys, I don't know who, but specifically told that they are going to try to, he's busy, but he's going to get an appointment within 1 or 2 weeks. It's more than that. So I don't know. Generally, I never had this type of problem with Alan's physio, not hearing any response or any update. It's okay. Okay, sorry, guys. Just talking to the doctor. So long term. Okay, sorry. Yeah. Okay, let us complete this one. Mm. So blood pressure, we all concerned about the blood pressure. When we have the normal blood pressure, we're happy, but sometimes that there is a fluctuations of the blood pressures, right? Okay. So what is the blood pressure? The force of blood exerted against the arterial walls by the contraction of the mainly the left ventricle. The ventricles are contracting both ventricles at the same time, but mainly the pulse is generated from the contribution of the contraction of the left ventricle, because from the left ventricle oxygenated blood is going to the aorta, and aorta is giving the blood to every parts of the body. So blood pressure is the force of blood exerted against the arterial walls and reported in the millimeters of mercury, the unit mmHg. What is the systole? Systole, you all guys know, it's the phase of the cardiac cycle when the ventricles contract. What is cardiac cycle? One systole and one diastole compose the cardiac cycle. So systole is the phase in the cardiac cycle in where the ventricle contracts. So systolic pressure, that is the pressure we are measuring as a blood pressure. Systolic pressure points of highest pressure on arterial walls. And what is the diastole? Is the phase in the cardiac cycle in which the heart relaxes between the contraction. So diastolic pressure, point of laser pressure on the arterial walls. So when you are measuring the blood pressure, we are getting the ventricular contraction and relaxation, contraction and relaxation, contraction and relaxation. So obviously pressure is one time high or low. That's why it beats per minute. Each minute you are getting that one. How many? 60 to 100 normal. So that's why you get the diastolic pressure and systolic pressure. That's why the blood pressure measurement instruments are formulated or structured. So why you need the blood pressure to measure? Person's blood pressure provides insight into the functioning of the body. High blood pressure, which can be caused from any reason, can cause the arteries to become weak because they are giving too much pressure. They may lose their elasticity because, like the elastic things, if you keep it always stressed out, it loses the elasticity to being the real contraction and relaxation. So high blood pressure can cause the arteries to become weak and damage and cause the heart to become weak and enlarged. Because heart cannot go back to the normal, back to the non-elastic phase again. So it's always stressed. So slowly it's going to lose its power of contractibility. And if they lose it, the heart is going to be relaxed. It cannot pump out or in or function as a normal way. Chronic high blood pressure can contribute to conditions such as vascular diseases, myocardial infarction, cerebral stroke, kidney disease, and vision loss. Because high blood pressure can go anywhere, can rupture, make a blood clot anywhere. Medical infarction, it can rupture and make a clot in your coronary artery or in the heart anywhere. It can cause the myocardial infarction. If it goes in the brain and something is ruptured a little bit, and then there will be blood clot in the brain or anywhere in the brain area, cerebral stroke. Kidney is continuously on high filtration, so it loses efficiency of the excreting the fluid as it should be because it's under constant high pressure. And obviously vision loss also from the leakage or the rupture of the blood. Interpretation of the blood pressure. Measurement expressed as a fraction. Numerator is systolic pressure and denominator is the diastolic pressure. So what is in the top and down? 120 by 80. 80 is the so top number is going to give you the systolic and down number is going to give you the diastolic. So diastolic pressure is going to be little bit less and systolic pressure is going to be high. Systolic pressure can change for anything, stress, exercise, anything. When the diastolic pressure is also high, then it's more concerned. So numerator is the systolic pressure, that is the top, and denominator is the diastolic pressure. 120 by 80, that means it's showing you systolic by diastolic pressure. Normal blood pressure for adult, systolic is 95 to 140. You remember, this is the systolic pressure 95 to 140 and diastolic is 60 to 90 because that time they are slowly moving from the SA nodes to AB nodes to Purkinje fiber. So firing rates are little bit less. Now you can understand what is the difference. SA node firing rate is 60 to 100, but it's giving you more. At the same time, atria is contracting or the ventricle is contracting. So normal blood pressure is 95, systolic is 95, but general normal blood pressure is 120 by 80 is the normal one, average. But individual, if you see
I
the
have a
systolic
question.
versus diastolic, so systolic is 95 to 140, that range is normal. If it is people come, oh, my blood pressure is 130, I have high blood pressure. Not at all. If it is go over 140, then think about that. 95 to 140 is okay. If it is blood pressure, also you have to see if your blood pressure is always ranging the lower range, and then you suddenly got this one, that may be considered as not high but not normal for that time.
Miss,
Yes.
I have a question. So which one is on the top, the systolic or the diastolic?
Systolic is the high number, high is systolic because you think
Okay.
ventricle is contract is giving more pressure, so you are getting the
Yeah.
higher value. Higher value. So
Okay.
that is the systolic. And when the ventricle relax, that is the diastole, the pressure is less. Because not that blood is going to the aorta. So it's less. So diastolic is the less.
Okay, thanks.
Okay? Okay. So hypertension is high blood pressure. Sustained systolic. Sustained means for not one day. It's sustaining more than 140 for maybe a week, maybe 2 weeks. And sustaining diastolics over 90. So if your blood pressure when reaches over 140 by 90 for 1 week or 2 weeks, then you can think that maybe I am getting the high blood pressure. It's only for 1 day, for the stress, emotional state, something thinking, some fever or exercise. Why you never know how is your body is working. 1 day I am having this blood pressure 130 over 80 or 130 over 90, people coming here, oh my God, I am high blood pressure, I may have stroke, I may have blood. This is the scenario in our country. They have very poor knowledge about the healthcare, or they are misusing our healthcare facility. Sorry to say that.
The
Okay.
normal rate is 120 over 80.
80. That is the perfectly normal, but the range is up to 140. Okay.
So 140 over 90 is high.
140 over 90 will be high, 100%. Over.
Yeah.
Over 140 by 90 is going to be the high. You are right, Asnan. Good.
Mm.
Factors affecting blood pressure. Age. As it increases, blood pressure usually increases. Gender. After puberty, women have a low blood pressure because estrogen is controlling that one. There is a hormonal things also. Diurnal blood pressure, BP is lower in the morning if you have a proper real good sleep, and higher in the afternoon because you are working whole day. But if our job is like this, day and night, blood pressure is always going to be high. Emotional
Okay,
stress.
Miss. So what if you
Yes.
get up in the morning and your blood pressure is high because you don't get enough sleep?
Yeah, maybe you didn't get enough sleep. Maybe you have some, you didn't, your digestion was not okay. Who knows? Yeah, blood pressure may be high if you are,
You're stressed.
yeah, stress. Yeah, every day
Stress.
when I go in the morning in the class after duty the night shift, my blood pressure is high
Yeah.
because I didn't sleep. And then I come back, then I have to, and I cannot take the medication at that time because if by chance I sleep or something, I may feel sleepy. So when I come back, take the medication. Sometimes I tell you I feel hot and I'm feeling high blood pressure. Because at the same time, if I'm young, it's not being be that much. When you are getting elder, the body takes time to adjust it.
Okay.
Yeah. Emotional state, obviously. Increase blood pressure, exercise, temporarily increase blood pressure, body position. Blood pressure varies based on the position. Make a notation if position is other than sitting, is the lying or standing. So sometimes we take the blood pressure because there is always a variation in blood pressure of some patients when they're lying to sitting or walking. That's they can feel dizziness. That is the postural tension, blood pressure. So that time you cannot get straight up from the bed. Start walk, you have to get up slowly, you have to sit in the bed for a couple of minutes, then you have to wake up slowly, then you have to stand on your feet couple of minutes, then you can walk. That is the postural problem of the tension, blood pressure. So body position is also, in general, you can take the blood pressure either in the lying condition or in the sitting condition, comfortable sitting condition. Standing is rare. When you need to check the postural things, then we do the standing. Medication. Sometimes the medications can make you, obviously, when you take the blood pressure medication, your blood pressure should be controlled. The medication has a little bit over, you may have low blood pressure. Sometimes, sometimes some medication may increase also your blood pressure. Recent meal, obese, smoking, bladder distension, pain can also increases blood pressure. Assessment of blood pressure, you need the equipment, is the blood pressure machine, it's called the stethoscope and sphygmomanometer. What is the sphygmo? This is called the blood pressure instrument. What is your medical term? Sphygmomanometer. Instrument for measuring arterial blood pressure. It measures the blood pressure in your artery. Two types. You have Android and Mercury. Also, when you are measuring the blood pressure, you have to see the blood pressure cuff. If it's too heavy built body, you have to use the larger one. If you have the medium, generally medium one is, the use in general. And also there is a pediatric one, which is small. They were very, very skinny. So cup size of cups refers to the inner bladder rather than the outer covering. You can see a white line, you can see. So when it's covered, you have to see it's covering up to the index line, not the outer one. A little bit outer flap is going to hanging out. When you go to the blood pressure measurement, you can see the extra part. There is a Velcro also. Velcro generally fits from here to here, and this extra flap is flapping outside. Must fit properly to ensure an accurate reading. So basically the cups should encircle your minimum 80% circumference of your arm. The child cup often use an adult with thin arms. Child cup, yeah, when the adult which are very, very thin or skinny, you can use the child cup. Adult cup used for average size adult. Thigh cup used for thigh or adult with the large arms. Thigh cups is the larger one, which we use sometimes, which has the very thicker or bigger built body, and the arms are very fatty. So that is called the thigh cap used for thigh or adults with large arms. Just give me a second, okay? Just there is a call. Sorry. Let me see who the colleagues for what. Call for selling the mobile phone. Right around the okay. So you are going to use your judgment which cup size you are going to use. In general, the medium cup size or the arm cup is used for everything. But if it's very too thin, where's the baby, where's the huge bulky body, so you can use your cup size as per your knowledge and experience and the depending on the patient. The center of inflatable bag directly over the brachial artery. You know where is the brachial artery, right? So you are going to put that back. There is an arrow. So you have to point the arrow toward the brachial artery, and Velcro is used to secure the cup. And the cup sizes, if cup is too small, readings are falsely high. If the cup is too large, readings are falsely low because even when the cup is too small, it's going to try to generate more pressure. And it's too large, it's loose. So it's not going to read the proper results. So you have to find out the suitable cup for your blood pressure measurement. So there is a measurement. The large adults is 33 to 47 centimeter arm. General adult is 25 to 35. And the child is more or less. So you guys can see whenever you are doing that. And what is Korat cup sounds? This is the sound you are using to hear the blood pressure. So this is used to determine the systolic and diastolic blood pressure. When the bladder or the cup, you put the air and the bladder or cup is inflated, what happened? When you put the pressure on the artery, artery is going to be compressed. So you cannot hear anything. So then slowly you can see when you deflate, when taking out the air, slowly, slowly, slowly. At one point, artery is, depression is gone. So it start working, bumping. And you can see a first sound. That sound is audible. And when now you release the cup and when blood flows freely, sounds no longer being heard. So before BP measurement, instruct patient to avoid caffeine, use of tobacco at least 30 minutes before blood pressure. Patient should be seated in a quiet room for at least 5 minutes. Select proper cup size. Never take BP over clothing. Sometimes some people does over the clothing. No, because you need the skin touch. All a roll up of patient sleep 5 inches away from the elbow. Position arm properly. It should be at heart level. Hand should be at the heart level, well supported, palm facing upward. So how you are ready to face? Your elbow should be at your heart level and your palm is facing upward and it should be rested in a proper well supported area. If above heart level, BP may be falsely low because maybe the blood cannot go up to is upward against that gravity. So how to prevent errors in the blood pressure? Avoid extraneous sounds from the cup, interfere with accurate measurement. If the patient has too much cupping, you cannot hear the blood pressure. It's difficult, though you are using the stethoscope. Position cup 1 to 2 inches above bend in elbow. So 1 to 2 inches above when your elbow is bending 1 to 2 inches. Prevent stethoscope from touching the cup. Don't touch the stethoscope. Total. Compress brachial artery completely. It's going to prevent 200 or 300, 200. So then center bladder or cup directly over the artery to compress. Most cups are labeled with arrows indicate the center of the bladder. So that the arrow that I told you, arrow is going to tell you where you are going to put the on the brachial artery. So then apply equal pressure over the brachial artery, apply cup so that it is more smoothly and slugly around the patient arms. We already discussed that. Okay, so position earpiece so that you can hear the. Then you have the stetho. So you have to know which side, how you have to place your stetho in a ear in such a way so that you can hear the sound. Also, you have to check your tubing and in the stato, the main where you are going to hear the vibration, whether it's the open or closed position. If it's closed, it's not good. You cannot hear the sound. You have to do open position. So before doing the blood work, you have to tap the stato face and you have to see whether you can hear the sound or not. Then you can do that one. So position chest properly, pitch properly, palpate brachial pulse to provide good positioning, chest piece over brachial artery, chest piece means that one. Place chest piece firmly but not gently over brachial artery. Do not allow chest piece to touch up the cup. So this is this one. Upper arm 2 to 3 inches above, arm is supported, and then cups at heart level. You have back support, feet on the flat floor. Then we are going to do the inflate the air, or the automatic one can do by their own selves. Test your knowledge now. What does the term eupnea refer to?
Normal respiration.
Good. What does the term, same question.
Oh, yes.
What is the name of the instrument that measures the arterial blood pressure?
Sphygmomanometer.
Yes. So you can see, not the stethoscope, sphygmomanometer. Good. What is the name of the instrument? Oh my God, why they are giving? Oh, they are giving one answer, one question. Okay. A person usually cannot survive with temperature below
34 degrees centigrade.
Good.
Letter A.
For the next class, bring 3 questions to class to discuss for review. I know you guys are not going to do that, it's optional. So it's done. Our ECG, heart, vitals, everyone is done, and you are going to exam right tomorrow, okay?
Study, miss. Time to study.
Yes, ma'am.
You already studied. You need to study.
You have to
Okay.
study more.
Okay.
Gotta study
Go.
more.
Okay, no problem. Go ahead.
All right.
Thank you.
Mhm.
Thank you, Miss.
Okay, no problem. I may not be on mic because I'm working on your review now.
Thank you,
Okay,
ma'am.
ma'am.
Appreciate
Thank
it.
you.
Okay, no problem. Because what happened, if you're on mic, I always listen to you guys' things and I respond. That's bad practice for me. Okay, so this is decision hard. Mun enter. So.
Nga abuya ka, nalpas kami.
Hey. Oof.
So this one is done.
Hi, Munin. This is Mun. Hello? Hello?
Hi.
Hi? Hello? Hello?
Yes, miss.
No, it's not you. Okay.
Miss Momo. Miss Momo. Okay.
Hello. Hello, Asmat.
Miss, I was just telling you that I was seeing your data sheet, so that's all right. You take it off.
It's okay. What data sheet? It's okay. Thank you.
Okay.
Yeah.
You're
This is student presence or absent. You all know who is present and who is absent today. I am not that formal. You saw me. Thank you. Thank you. Thank you.
Okay.
Thank you. Thank you. Attendance data. Let me close this one. Okay. This is my better. I can stop sharing. I don't hasn't have to do anything, right? That is better idea. Thank you. I am mainly doing it all the studies, nothing personal. Even I am too old to show you the personal things. I have no boyfriend. Chatting. Okay, okay, no problem. Let's study. Hello, team. So see you tomorrow. Best of luck for your exams.
Thank you, ma'am. See you
Thank you,
tomorrow.
Miss.
See you tomorrow.
See you tomorrow.
Thank you, Miss. See you tomorrow.
Okay, so everybody is getting good marks. Promise. Otherwise,
Yes.
if I don't get the high marks, I'm not going to send the midterm interview.
No, we get the marks, Miss.
Yes,
We
yes.
tried
That's
our
the
best.
that's the deal. That's the deal. You
That's
guys
the
are
deal.
making me work. So I need some interest.
Okay,
No
Miss.
problem,
Thank
Miss.
you.
Thank you.
Okay.
Try our
Okay.
best.
Bye bye.
Take care. Bye bye.
Bye.
Everyone.